Welcome, everybody. I hope we have a great day. It's really an honor for me to be here and to give an introduction to blood EVs. What I will try to do is to give an overview, and this is really difficult because it's a large field, it's rapidly expanding, and it's very easy to get lost. So I hope that my view on what I think is the world right now in blood EV research, I hope that you appreciate it. First of all, I think you are all aware that the interest, the scientific and clinical interest in extracellular vesicles is expanding, growing very rapidly. What you see here is the annual number of publications, and you see we're nearly at 5,000 papers a year on extracellular vesicles. Now, one of the reasons, especially clinicians are interested in extracellular vesicles, is because these vesicles are present in all body fluids. They're present there in health and disease. And people think that if they can detect and analyze vesicles, you can get clinical relevant information about health and disease. Blood apparently is a very interesting body fluid for EV research. In 2015 and 2019, ISEV performed 2 surveys amongst their members. And one of the questions was, what body fluids do you use as a starting material for your research on vesicles? So what you see here are the fluids, and here is the percentage of respondents. And now if you look at the body fluid that's mostly used for EV biomarker research or EV research in general, it is blood plasma, where serum is the next one. And CCM is conditioned calcium medium free of serum, and this is with a supplement. But the important thing is plasma and serum, the fluids from blood, are the most widely used fluids studied by people in the field for EV research. Now, sometimes, that's why I said this is really an introduction. My feeling is that people are not really aware about that you do not measure the vesicle directly in blood itself, but in the fluids. And actually, there are 2 fluids that you can prepare from collected blood, and they are quite different regarding EV research. And after reviewing many papers, I still think that people are getting lost here a bit. So I put in this introductory slide not to how do you say that? It's meant as a guidance here. So in reality, if you also look at the previous slide, plasma is the most widely used body fluid. And if you collect plasma, and plasma is prepared from blood by centrifugation, so you collect blood, but the blood has to contain an anticoagulant. You need something to prevent the clotting of the blood. But the interesting thing, so once you start to prepare anticoagulated blood, once you centrifuge it, you get plasma, and plasma is what I would call the normal body fluid. It's the fluid as it's present in your blood containing the cells, the vesicles, lipoprotein particles, etc. But again, it requires an anticoagulation, and that is causing many problems for vesicle research, for standardization, etc. So this is a hurdle. You need to remove really all cells per centrifugation, and that is really tricky. I think also Fabrice later on will show, and we have some data on it, that if you prepare plasma, there are still platelets in it. Whatever you do, you still have platelets left, and you should be aware of that for your downstream analysis of vesicles. Vesicles, especially from platelets, are also generated during collection and handling, so during centrifugation. So you have to be aware that what you measure in your tube is not necessarily what was present in the circulation. And plasma, despite the anticoagulation, sometimes can still clot, especially after freezing for a long time in the fridge. So these are all sort of pros and cons. Serum, again, is very different. It does not require anticoagulation, so I think that's a big advantage. But it's the product of blood clotting in vitro. So what happens is when the blood's standing on the table without anticoagulant, the blood will clot, you get fibrin formation. The advantage is that if you remove the fibrin clot by centrifugation, so like plasma, you need 1 or more centrifugation steps, You get the serum, but it's platelet-free, really platelet-free, so I think that's a big advantage too. But you also get piles of vesicles generated during the clot formation process. So you have extreme amounts of platelet vesicles there. So that's a drawback. If you want to look at rare vesicles, like, let's say from a tumor cell, you're diluting those by generating all these platelet vesicles. So serum requires clot removal, and sometimes vesicles, platelet vesicles, also may get lost because they bind to the clot that you try to remove. So keep in mind that these fluids are really very different as a starting material for your research. And just one example, this is work from the group of Pia, but I think it's nice to show here that if you collect blood from the same donors and you collect plasma prepared anticoagulated by different anticoagulants, and you prepare serum from the same patient, what you see is if you look at the events, the CD61 positive events, so the vesicles from platelets, what you see, there's a variation here, but you see that in serum, the level of CD61 positive vesicles, so the platelet vesicles, is much higher in your starting material. Can be a drawback, doesn't have to be, but you really should be aware. So serum, for sure, is not the fluid in which the vesicles are present in your blood. It's a sort of in vitro prepared fluid, but it has advantages too. One of the things I think that was really a hallmark paper that came out in 2014, it was the first paper from the group of Besson. He used electron microscopy showing that if you look at the vesicles present in normal human plasma, that these vesicles have various sizes. And when he grouped them per size, here you see what he called microvesicles, but we now would call it extracellular vesicles, but you see the percentages here. Here you see the data they've been, so this is 30 to 100 nanometer, 100 to 200 nanometer, but what you see is that the bulk of the vesicles is really small. So until that time, people often thought you have small vesicles, exosomes, and larger vesicles, like what you call microvesicles, but that's not true. It's a continuum. It goes from platelet size to very small, and the bulk is really very small. Okay, now this is really important. And why is this important? Because if you keep in mind that you can estimate the concentration of vesicles more or less, I show in a minute that's difficult, but assume that we know more or less the concentration and you know how much vesicles you have of a particular size, it's very easy to calculate the total volume and the total surface area. Of course, these are estimates, can be a bit more, can be a bit less, but it's just to show you that if you estimate the volume of vesicles in 1 ml of plasma or urine, the volume of these vesicles is very small. It's about 50 nanometer, meaning if you put it as a percentage of, let's say, of plasma, it is 0.00005%. Meaning that if you do downstream analysis like omics, and you have to isolate the vesicles first from plasma, you have a big problem. But because how do you purify, isolate 0.00005%? That's very tricky. Yeah. But at the same time, the vesicles have a huge surface area. And of course, it can be a bit more, can be a bit less, but it's estimated 1,600 square millimeter per mil of body fluid. That's a lot. It's something you can see. Yeah. So tiny volume, large surface area. And it's important. It may be important and much more important than we realized until now. Show you in a minute. So, of course, also a question is, what do vesicles in blood do? And if I'm honest, I think I have no clue. So what people in general think about what vesicles do is vesicles are involved in transporting cargo, they facilitate intercellular communication, waste management, etc., etc., etc. So probably this also holds true for vesicles within the blood. And I think there's a nice recent development, and that relates back to the fact that vesicles have a very large surface area within the blood, that there's now some evidence, and these are two papers, one from the group of Pia and one from Edith, showing that vesicles in normal human plasma may carry proteins on the surface with all sorts of functions. So perhaps more the surface of vesicles is used as for cargo transporting rather than what you can store inside these vesicles. It's something to keep in mind, but I think it's an important development. And I think there's also an increasing numbers of papers, and not necessarily published in JEF, but also in papers like Blood and Journal of Thrombosis, Haemostasis, etc., Blood Advances in this example, showing that blood vesicles can also have functions unrelated to transport. But for example, in this example, that the vesicles present in the blood of patients with severe COVID infections, these vesicles expose the protein that triggers blood clotting. And the presence of these vesicles also in cancer is strongly associated with development of venous thrombosis and with bleeding. So vesicles may also play a role in coagulation, but it's a non-transport function, so be aware of that. So what I said is that there's clinical interest, especially because vesicles in blood may offer potential biomarkers. And the question, of course, is for me as a biologist, what is a biomarker? And various definitions are there. You can find them in literature. All these three are coming from the paper that I cited below. And actually, I liked the one from the NIH the best, although it's a bit long. But it's a characteristic that's objectively measured and evaluated as an indicator of normal biological processes, so also in health, pathogenic processes, or pharmacologic responses to a therapeutic intervention. And I try to visualize this in something that also I understand. So it was a coincidence, but I was reading an old Donald Duck from 2014 last week. And I looked at the cover and you see all the mosquito bites. And what is a biomarker? I think if you look at this picture, I would say it's quantifying the mosquito bites per surface area. And if you look at the bites, you can have all sorts of characteristics that you can define: the height, circumference, coloration, composition, volume. You can associate it with clinical outcome, etc. Well, this is precisely what we do with vesicles, because if you now look at vesicles and you look at what are potential blood EV biomarkers, we look at where do these vesicles come from, what's the composition, what's the concentration, and what do they do. And I think it's not so very different from the example I just showed you. Now, if you want to study vesicles from blood, you face challenges. And some challenges are because it's blood, and some challenges are there simply because it's a body fluid like all other body fluids. So what are these challenges? Well, I try to summarize them, but I think there are four major challenges. One is the complexity of blood. The second one is the biospecimen, but of course that holds true for all samples. I'll show you slides on this in a minute. It's the pre-analytics and it's analytics. So what do I mean? Well, if you look at the complexity, blood is a very nasty fluid to work with. I mean, it is, well, I don't know, it's sticky, density, viscosity is high. It contains small cells like platelets that overlap in diameter with vesicles, very high concentrations of non-EV particles like lipoproteins that overlap in size and density with vesicles. So it's really a messy fluid. And you can see it here. If you remove the cells, and this is an electron microscope picture from plasma, you do see a few vesicles, but you also see they are present in a soup of chylomicrons and lipoprotein particles. So these vesicles are not alone. They are there still in a pile of other non-EV particles. Now, regarding the biospecimen, it's something I think it's completely not understood yet, but you can think of age, gender, lifestyle, medication, everything may or may not affect the presence and the composition of the vesicles in body fluids. And we don't know this yet. But I think the only thing you can do is write down most of these variables in your paper, and that's about it. Now, and this is really a big problem in the whole EV field when you're working with blood, and that's the problem of the pre-analytics. So this is the entire phase of collection, handling, and storage of your blood. And usually blood is like plasma and serum are stored before you do your final analysis. And just to give you an idea, in the paper in 2019 published in JEF, we looked a bit at this. we can easily define over 40 different variables in this phase of pre-analytics. And essentially, all of these 40 variables may affect the outcome regarding the presence and the composition and the function of these vesicles. And which ones are important and which ones are less important, I think we have no clue yet. A few we suspect, but the evidence is still thin. People are working on that. And for example, tomorrow we have a few talks on the effect of anticoagulants. So people are really actively working on this. Now, regarding the analytics, and that's also a problem, we're still not there. With analytics, I mean the phase of you have your plasma, your serum sample, you isolate your vesicles, and then you're going to detect them. Or you can sometimes directly detect them with methods such as flow cytometry. Now, if you look at all these variables, so this complexity, these challenges, complexity, biospecimen, pre-analytics, analytics, yeah, where are we then with vesicles and biomarkers in blood? Well, I showed you that we have, I think, 4 main topics there regarding blood EVs, biomarkers, origin, composition, concentration, functions. We have all these challenges. Again, we cannot measure things directly in blood, but we have to compare plasma serum first with challenges. But just look at one. It's the concentration. And it's show this because we work most on that ourselves. So where are we with measuring the concentration of vesicles in normal human plasma? So the plasma of me or you, or all the audience. Now, what's the concentration of vesicles in normal human plasma? The reported concentration in the literature in the last 5 or 10 years ranges between 10 to the 4th to 10 to the 12th per mil. And meaning it's from a mole's hub to the Mount Everest in 1 tube of plasma. It's ridiculous. If you have 10 to the 8th-fold difference between these measurements, you never get anywhere. So I think it's a major problem. And the problem is, and I think it's now really quite well recognized in the field, and now we started working on it, we all have single center studies, and it's beautiful. We're all very enthusiastic about our work, but apparently it doesn't help the field very much because we still cannot compare the data. So I think as long as we are unable to compare the data, we cannot do any multi-center studies. We have no biomarker potential. And I think when I look at it from even bigger distance, I think the credibility of EV research in general is at risk. I mean, if you keep on producing data that are incomparable and are not reproducible, I think we end up nowhere. So it's Wild West, and we are trying now to establish law and order. And I think ISEV is very active in that, and I think I encourage this very much because I think it's very important. If we don't do this now, the field will never get anywhere, sorry to say. So towards reproducible EV research, what's going on? Well, if you want to build a house, you need to have a few things in place. You need a blueprint, you need your building materials, you need scaffolding, all the stuff. And if one of these elements is lacking, you have constructions that are unstable. They fall apart sooner or later. So what do we need for this vesicle research to become reproducible? I think the 4 main topics that I see right now, we have to share good practice. For example, looking at our research for 25 years, we've made lots of mistakes, but sharing these mistakes with the rest of the world may help the rest of the world not to make the same mistakes. Standardization, second item, reporting and education. And now, I'm sorry, it's a boring slide, but I think I'm still going to show it. If we say sharing good practice, examples are the ISEV every 3-4 years. We have some papers with guidelines, position papers are coming out. Standardization, I think there's really a lot going on. So we have, ISEV has established a rigor and standardization subcommittee. Within this subcommittee, there are now 10 or 12 task forces active, and one of these task forces is working on vesicles in blood. But also importantly, calibration infrastructure is developed, and I think Edwin will also tell a bit about that, meaning that if you measure the vesicles on different instruments, in his case flow cytometers, you can still compare the data in absolute quantities. And that's really important because then we can start comparing data. And nowadays also interlaboratory comparison studies are going on between 10, 20 or more laboratories, seeing whether you can measure the same concentration of vesicles in a provided sample, whether you can measure the same clotting activity in provided samples. So several of these studies are ongoing. Can we compare data? Reporting has often and still is non-transparent. So we need transparent reporting. EV-Track is a good example of that, but also the MyFlowSite EV that has recently come out and is endorsed and supported by ISEV, but also ISTH and ISEC. I think it's a real good example. And of course, we need education. We have massive open online courses, thirds coming this year on detection and isolation of vesicles. There's an educational compendium on flow cytometry, I hope coming out this year, published in JEF. So all these things are actively going on right now. And if you want an overview of all these things, and there are more than I can show on these slides, there are two papers I would like to recommend. There's an editorial that was published in JEF 2 years ago, I think 2020, Rigor and Standardization of Extracellular Vesicle Research. And a more or less similar paper, but going a bit more into detail, was published this year. It's in the journal, European Journal Cell Biology. But I can recommend these papers because they really try to sum up an overview of everything that's now ongoing. And this is just one of the tables from this last paper, but you see per year, we have tried to summarize all the attempts that are ongoing. As I said, it's really a lot. So just one thing about the Blood EV task force. It was founded in 2019. I think it was the first task force that became active. And we really try to give some clever recommendations about how people can actively work on standardization of blood EV research. And in that paper, we propose a roadmap. And one of the things we do in this paper is we show this graph. I modified it here, but one of the things, and I think also Fabrice will talk about, is we need sample quality control procedures, checking the qualities of the samples we prepare, especially for biobanks. So this is the scheme. So we have the blood as a complex fluid, the biospecimen variables in pre-analytics. We are trying to prepare samples of biobanks for EV research. We isolate and detect vesicles, reporting, clinical biomarker, reference range. There's some talks about that later on. That's an example of clinical biomarkers. Now, how does it work today? At least from my perspective, I think Edith will give an overview about the blood complexity in her talk. Fabrice from my clinic will tell something about sample quality control procedures and establishing reliable biobanks for clinical EV research. I think very important topic too. Ken will talk about detection of extracellular vesicles in blood or in general. Edwin will also tell you something about this, and he will focus on flow cytometry. Alexandra will give a talk on clinical biomarkers, biomarkers from a clinical perspective. And both Metka and I think also Edwin will talk about establishing reference ranges and what reference ranges are for blood vesicles later on. So yeah, I still would like to thank all the people from my group because I think they're helping me very much with everything I can do and show you. So that's it. Thank you. Nobody started crying or left.
Nobody started.
There are two good signs. Nobody started throwing eggs or tomatoes. So
Maybe Pia.
Yeah. And I hope I offended nobody, but
but I don't know if I dare to. Thinking about the very beginning, wait, plasma is cutting somehow. So
plasma's here. Yeah.
I've always thought that plasma is much better to analyze body fluids, lipids, because it has these inhibitors of the lipases, for instance. And I wonder, have anyone here you thought about this aspect related to the EVs? Because EVs are, as you showed, this is cutting a lot of surface, so.
Well, it's a good question. Actually, in so many papers, I noticed that people are not really aware of differences between plasma and serum in general. I discussed with Pia that maybe we should write a paper about whether to use plasma or serum for EV research, but perhaps we should include you as a co-author, as an expert on this topic.
With my pleasure.
But to answer your question, I have no clue.
Great. Thank you very much, Rienk, for the very nice talk. So we would like to analyze rare EVs in blood. What would be the suggestion? Because of course there are many like lipoprotein particles that outnumber the vesicles, and I can imagine that enriching the rare EVs would be one approach, perhaps also high throughput for some techniques. What is your opinion on this?
Well, I think it's a real good question. Well, the easiest answer is contact Edwin or me. The second answer is, if you think about isolation of blood, essentially there are only, I think, 4 principles. You can separate particles based on size, on charge, immunophenotype, and density. And what you now see in the literature is that people have been using one of these principles, like SEC, for example, to separate particles on size. Then they used SEC fractions containing the vesicles, and then they start working with these fractions and saying, I'm working with purified EVs, which is not true, because also the lipoprotein fraction is there. So you need also a density gradient. So what you now see in the literature is that people are starting to use one principle of separation after the other to better purify the vesicles. So first SEC and then density, or first the density and then SEC. But I think all sorts of combinations can be made and will be made in the future to get more pure EVs. Problem is, every purification step you're losing vesicles, you may lose subpopulation of vesicles. So yeah, and as long as we have analytics not in place, we have no tools to screen that. The good thing is, if we have analytics in place, and I think we are nearly there for flow cytometry, then at least we can screen all these fractions, and we can screen all the biospecimen variables and pre-analytics and isolation procedures. So yeah, it's a very good question, but it's very difficult to answer, I think, right now with the knowledge we have.
Thank you.
Thank you. Well, thank you for your nice presentation. I just want to add one point. I think purification of EVs from the blood is a kind of controversial, because if you want to purify EVs from the lipid particles, from the proteins like albumin, maybe you damage your EVs, because these all protect EVs from damage. For example, albumin try to decorate EVs.
Mm-hmm.
It is a lipid carrying protein, so help to protect EVs from damage. But if you try to take the albumin and all the lipid particles from it, maybe it needs to do it. Maybe you destroy your EVs. On the other hand, if you don't purify your EVs, so there are many contamination, and they may also not good for us.
Yeah, well, it's really a good point. The point is, I think it's the same with anticoagulants, for example. We do know that the anticoagulants that strongest are chelating calcium are the best to circumvent platelet activation, and they prevent clotting very effectively. But perhaps if you chelate calcium from your blood very efficiently, also the corona of the vesicles goes off. We don't know. So I think all these, very valid questions. I think in general, we still don't have the instruments and the tools to work with it. But it's a really good point, yes.
If nobody else, then I will ask. So it's the Wild West, and we need to set up the law and order. So who's going to be the sheriff and who's going to be the vigilante?
Well, I think in the end, I hope that let's say the reviewers and the editors are the people responsible for publishing decent work. And I think it's really nice that, for example, in 2015, ISEV, together with ISTH and ISEC, started the flow cytometry working group on flow cytometry. And now, after 6-7 years, papers are coming out from this group. And what is really nice is that this my flow cyte paper, that was a position paper in GEF. It's the reporting framework, how to report flow cytometry data of vesicles in an honest and transparent manner. And in the paper, you can find all the controls, etc., that you should do. This framework is promoted by ISTH via an SSC communication, meaning that also the ISTH really think this is important, and also ISEC supported this. So I think step by step, we should get these societies on board, editors on board, and then improve. And then I'm sure that sooner or later quality will be recognized.
Thank you. Yes. What I forgot to say in the introduction is that this meeting is endorsed by ISTH, so the International Society of Thrombosis and Haemostasis. So it's also a collaborative effort. Any other questions in the audience? Okay. Yeah, thank you. Okay, we have one question from the chat. So Vijaya is asking, what is the best way to define the purity of blood EVs and how can we do it?
Well, I think it's a real good question. I think it's difficult to answer. Perhaps Edith will tell something about that, but my first feeling is if you quantify, if you are sure that you have starting material that's really free of platelets, because I think that's essential, it's really hard to get rid of platelets, and you quantify the contamination of soluble proteins and lipoproteins in what you have prepared, I think then you have done a good job already. But also here, I think it's common sense and it's also work in progress. I think people have often claimed that they really were looking at vesicles, but if you put plasma and ultracentrifuge, you will not get only vesicles. You will get a lot of other stuff as well. So there's a lot of bias in the literature, and I think we should not be afraid to say that. I think we should be honest. I think with the knowledge I have now, everything we have done older than 5 years in Amsterdam from our group, don't read it. It's bullshit. But many people won't say that.
Okay, it's maybe nice to finish here. Thank you, Rienk.